So a question I receive sometimes is, Dr. Dyer, I have bone loss around one or more of my teeth, and so I was thinking I need to come to you and have some dental implants done. But I would tell you the first thing I would recommend is one, what caused that bone loss, and let's address that first. What if we could restore the bone back around in your teeth? What if you could keep those teeth? You know, the best set of teeth you're ever going to have are the ones God gave you. And all the teeth that we would go in there and replace with dental implants aren't as good as your original equipment. I mean, they're functional, they work, but they're not as good as what God gave you the first time. And so the first thing we look at is one, what caused the bone loss? Two, is it repairable? You know, there's different types of procedures. We can use regeneration to repair the bone and the gum around teeth. If a tooth is fractured or broken, we can use a process called crown lengthening, where a crown can be placed on top of it. Or maybe you need gum disease treatment and then you need braces. That's still your ideal, your best alternative. And if those alternatives aren't what you need, then sure, we'll do dental implants as well. But even when we're doing dental implants, we want to make sure that the area that we're going to place them is healthy. We want everything to look ideal so that when you smile in the mirrors, there's no gaps. You know, my favorite types of post-ops that I get, we do yearly maintenance checks on patients that we do implants on. And my favorite question and answer is, I'll say, well, how are your implants doing? And they'll say, oh, great, doc, great. And I say, well, which area is your implant in? And I will tell you that, especially after a couple of years, patients can't remember, they can't tell which are their natural teeth and which are their implants. In other words, when they look in the mirror, all they see is teeth. And when they're eating, they're chewing, all they feel are their teeth. They don't really feel anything different from their natural teeth to their dental implants. I love that.